Pernicious anemia is an autoimmune disorder caused by a deficiency of intrinsic factor that interferes with the absorption of vitamin B12. Vitamin B12 is also known as cobalamin. Vitamin B12 is needed for folic acid to properly synthesize DNA for red blood cell production. Pernicious anemia results in large, abnormally shaped immature red blood cells called megaloblasts. Pernicious anemia is a type of megaloblastic anemia. In a normal person, vitamin B12 is consumed in food like eggs, milk, fish, and red meat. When the vitamin B12 from the food goes into the stomach, the parietal cells within the stomach lining secrete a protein called intrinsic factor. The intrinsic factor binds with the vitamin B12 molecules and travels through the small intestine to the distal ileum for absorption. Vitamin B12 is necessary for folic acid absorption. Folic acid is important in the synthesis of DNA for proper red blood cell growth and cell division. A deficiency in vitamin B12 leads to folic acid deficiency. Without intrinsic factor, vitamin B12 cannot be absorbed, so the red blood cells do not mature or divide. They stay large and are unable to carry oxygen throughout the bloodstream. This leads to fewer oxygen-carrying red blood cells and higher MCV. Pernicious anemia is caused by a lack of intrinsic factor. The lack of intrinsic factor can be due to various reasons like immune-mediated destruction of parietal cells. In this case, antibodies attack the parietal cells and damages them to where they are not able to produce intrinsic factor. Surgeries such as gastrectomies or bariatric surgery. Signs and symptoms include abnormally pale skin or pallor, red, smooth, beefy tongue, fatigue, poor balance, tingling in hands and feet, confusion, depression, and changes in behavior. Pernicious anemia tests include bone marrow biopsy and bone marrow aspirate, complete blood count, serum B12 levels, intrinsic factor antibody tests, and methylmalonic acid tests. Pernicious anemia can be treated by vitamin B12 injections and dietary supplements for inadequate intake. Nursing implications include education on unsteady balance and gait, administration of vitamin B12 injections weekly, monthly, and throughout their lifetime, education on oral hygiene due to changes to the tongue, and education on diet to include foods high in vitamin B12 like meat, fish, eggs, and dairy.